All right, let's talk the urinary tract. First, we're going to talk about the histological and anatomical structures. Organization of the kidneys. The cortex contains the renal corpuscles and convoluted tubules. And then medulla contains the loops of Henle and collecting ducts. And then the functional unit is the nephrons. So first we're going to talk about the renal corpuscles. The renal corpuscles include the glomerulus, fenestrated capillaries, the Bowman's capsule. So the Bowman's capsule has the parietal layer with the simple squamous epithelium, and then the visceral layer with podocytes, filtration slits, and then there is the filtration barrier with the endothelium, basement membrane, and the podocyte slit diaphragm. And then there's the proximal convoluted tubule with the PCT, and that's that has simple cuboidal cells with microvilli, high mitochondria, which activates transport and reabsorbs about 65 to 70% of filtrate. Next is loop of Henle. I don't know how to say that. Um, Anyways, this is so the descending limb is porous to water, and then the ascending limb, um, there's the thin, which is passive sodium and chloride movement, and then the thick part is active sodium, potassium, and chloride transport. And then we have the distal convoluted tubule, which is DCT, which have fewer microvilli, hormone sensitive, such as aldosterone and PTH. And then we have the collecting duct, which includes the principal cells, sodium and water regulation, intercalated cells, and those are acid based, balanced. So other structures in the urinary system are the ureters, which is transitional epithelium and peristalsis, the bladder, um, which includes the detrusor muscle and stretch receptors, and then the urethra, which is the internal smooth and external skeletal sphincters. And then we're going to talk about the regulatory and physiological roles. So the urinary system maintains fluid balance, electrolyte homeostasis, acid-base balance, blood pressure, and waste removal. And then the nephrons carry out filtration, reabsorption, secretion, and excretion. Next, we're going to talk about filtration, reabsorption, and secretion by segment. So the glomerulus, which is filtration, it's driven by the hydrostatic pressure, and it produces protein-free filtrate. And then PCT, is the bulk filtration. So it reabsorbs glucose, amino acids, sodium, and water, and then secretes hydrogen, drugs, and toxins. The loop of Henle, which creates medullary osmotic gradient. The descending was where water leaves. Ascending is when salts leave and the water stays. DCT is the fine regulation of sodium reabsorption, calcium reabsorption, and some acid-based control. Collecting duct, water reabsorption through ADH, urea recycling, and fine urine concentration. So now we're going to talk about regulation of glomerular filtration rate, the filtration rate, and then the key pressures are glomerular hydrostatic pressure, which promotes filtration, and then plasma oncotic pressure, and then capsular pressure. Autoregulation is so that's myogenic response. Afferent arterial constricts if blood pressure rises, and then tubuloglomerular feedback. So that's when the macula densa senses sodium chloride, and it adjusts afferent to the arterial tone. Hormonal control. Renin, angiotensin, aldosterone system constricts efferent arterial, and then maintains GFR. ANP, arterial arterial natriuretic peptide. So this increases the GFR and promotes sodium excretion. And then neural control, which is activated through this sympathetic activation, and it's decreased GFR during stress. And now we're going to talk about regulation of urine excretion. So hormonal regulation, antidiuretic hormone that increases water porous in collecting ducts and concentrates the urine. Aldosterone increases sodium reabsorption and potassium secretion. ANP promotes sodium and water excretion, and PTH increases calcium reabsorption. Now we're going to talk about the effects of aging and disease. So aging changes. So as we age, it decreases the nephron numbers, decreases renal blood flow, decreases GFR, reduces the ability to concentration, and we are at an increased risk of dehydration. Some common diseases are chronic kidney disease, which is the progressive nephron loss. Causes of this from diabetes and hypertension, and it can lead to uremia. Acute kidney injury is the sudden loss of function, and the causes are ischemia and toxins. Another one is glomerulonephritis, which is inflammation of the glomeruli, and then kidney stones, which is the crystallization of minerals like calcium and uric acid. And then, of course, UTIs, which are bacterial most of the time, and then they can ascend into the kidneys. And that's all I have for you on the urinary system.